This is the introduction and perspectives on personality disorders in modern life. When we think about personality, and we have to start off with that as a definition if we're going to talk about what personality disorders are, we can think of personality in a number of ways. Years ago, the ancient Greeks used to think of persona as this mask. So this is where this word comes from. So the individuals, they would be acting, they'd wind up putting this mask on and portraying this particular role. Over the years, this definition has changed. Particularly when we look at the influence of things like behaviorism, there would be more of an emphasis on outer behavior and what the individual would do. However, if we're being complete in our definition, we also have to consider the inner characteristics of an individual. And what do I mean by that in terms of the inner characteristics of an individual? Yeah, what they think about, how they feel. So when you look at these two in particular, what a person does from an overt perspective, what they think about, and ultimately how they feel about things. And so if we had to give a definition then of personality, we would say it's characteristic ways of thinking, feeling, and behaving. And we could add into this definition that there's an element of stability to personality. This is in contrast to a personality state. And so when we're talking about a personality disorder, and this is an important point, it's a funny term, this personality disorder. Some personalities actually are not disorganized in their presentation. Compulsive personalities, for example, are not necessarily disorganized in their presentation. But what we can say about an individual when they have a personality disorder, they're behaving in a way which is maladaptive in a variety of ways. So let's just flesh out this definition of personality. When you use that term, personality, it often refers to personality traits. And we have to keep the concept of trait in mind when we're thinking about personality disorders. When we talk about the concept of traits versus states, what's the difference between a trait and a state? So traits refer to this enduring way of being, whereas a state is something which tends to be more transitory in nature. Let me ask you this question. How many of you have been so mad at someone you've either hit them or threw something against the wall or slammed a door? Show of hands. All right. Now, would you say that you are personality disordered when you say something like that? When you're in that, part of the reason I'm asking you this is that I want you to think about what it would be like if you had a personality disorder. It would be like being angry like that all the time, or being anxious all the time and in a pervasive type of way. So what we could say when we look at a personality disorder, when people have a personality disorder, they exhibit traits just like the rest of us, except for in particular areas, they're very extreme. So if we take a term like conscientious, well, on a scale of 0 to 10, conscientious person would say, well, it's adaptive at 7 or 8. Once you get into the 11 and 12 range, this is when it starts to become maladaptive. And that is the key word here. Traits which are maladaptive. And the really wild thing about this is that they can be maladaptive in different ways, along different dimensions. It's not always the same way. This is why we've got different types of personality disorders. To summarize, the perspective from psychology is this. People who have personality disorders have the same traits as everybody else. They are just pushed to the extreme. The more extreme the traits are, the less flexible they are in interpersonal situations. So what are some of the areas which tend to be affected when people have a personality disorder? Cognition tends to be affected. What do we mean by this? We're talking about the person's belief system, what they believe about themselves, what they believe about other people. Their interpersonal relationships are disrupted. In fact, it's been suggested that personality disorders are disorders of interpersonal relationships. When people have a personality disorder, they have trouble with people, generally speaking, one way or the other. Impulse control is another area. What do I mean by that, impulse control? Yes, so that's one aspect of it, being non-reflective, or even the failure to delay gratification. So we all have desires. There's all things that we want. But we have this frontal lobe which kicks in and says, that is not a good idea right about now. With some individuals with PDs, this seems to be absent for some reason. And then also we can look at emotional functioning. The problems that people have when they have PDs is all over the place, from being really flat to being overly dramatic and so forth. So there's a lot of manifestations of emotional problems. And just to kind of give you some examples of this, when you look at avoidant personalities, which will be one of the topics we're going to cover, avoidant personalities believe that other people are superior to them and that they are inferior, and they believe this in a profound way. Interestingly enough, narcissists see it exactly the opposite way. They see themselves as great and everybody else is inferior. So you can see why there's problems. A number of personality disorders seem to have clear-cut interpersonal consequences. For example, antisocial personalities, they violate interpersonal boundaries. People with borderline personality, in some cases, will violate boundaries. Even people with compulsive personality will sometimes violate boundaries. Antisocial personality and borderline PD in particular, impulse control is affected. Other areas that are affected in terms of affect, schizoid personalities, there's the absolute absence of emotions for them. And at a minimum, you need 2 out of the 4 areas or more to be affected. If we want to take a look at how this course kind of fits in the grand scheme of things, we could say that this one circle, the green circle, is representing what personality is all about, everything that we'd possibly study. Off to the far right, we have this red circle representing abnormal psych. Personality disorders refer to this middle section. So it's, in other words, it's really the interface between what we would call personology and psychiatry. Now, as you look at this, it would seem that this would be a natural connection when you take a look at the relationship between personality psychology and abnormal psych. The really wild thing about this is, until about the last 15 years or so, there really hasn't been an integration of the 2 fields. When they talked about personality psych, this was considered in the normal realm of things, and this was in the abnormal realm of things. Personality disorders, you're sort of on the fringe of both of these areas. What are the characteristics of personality disorders? This is just a partial list. There's others we could add in here. As I was indicating earlier, these are individuals that exhibit inflexible traits. And the assumption here is that health is premised upon flexibility. How many of you have worked with a very inflexible person in your time? Show of hands. And what's that like for you? It's very frustrating. You have particular reactions to these individuals. It's generally not a good experience. And there's a difference between being stubborn and being personality disordered. Stubborn could even be temporary. When you're personality disorder, you're always in that direction. This leads to maladaptive behavior, an uncompromising way of being. Personality disorders are long-standing. And what do I mean by that? Yeah, that's exactly right. You're looking at a pattern of years, usually begins in childhood or adolescence, and continues throughout the person's life. Personality disorders are pervasive in a person's life, meaning they affect everything that the individual does, their work relationships, their social relationships. It is very difficult to know what to do to treat an individual when they have a personality disorder. We're actually at a loss as to what to do. It's even been suggested that cases where an individual would be, say, depressed, but they have a coexisting personality disorder, the treatment for depression probably isn't going to work because of the underlying personality. The person continues to put themselves back in the same circumstance, and they process information in the same way that makes it difficult to become non-depressed. And finally, we could say that it's an egosyntonic condition. What does that mean? How would you define this? Their problems are natural. Their maladaptive way is natural for them. And if you don't think there's anything wrong with you, and there's all these problems going on around you, what do? Who do you blame? You blame everybody else. That's another thing we find with persons with PDs. They don't take personal responsibility. They wind up externalizing. And that's really a key issue here. I'm hoping that as we go through this course, you're not self-diagnosing or diagnosing your family members.